Palak. I am radiation oncologist. Today we'll talk about the risk factors of lung cancer. Lung cancer is one of the most common cancers both in male and female worldwide as well as India. The cancer related incidence and the mortality, that is the cancer related death, is highest in the lung cancer in both the male and females. So if we talk about the risk factors related to the lung cancer, the most common is the smoking. The 90% of the lung cancers are related to tobacco smoking in any form. The risk of getting lung cancer increases with the time period exposed to the smoking. That is, the younger you start smoking and the longer period you keep on doing the smoking, and the more the bundles of smoke you take per day, the risk of getting the cancer increases. Smoking can be also, this is the first hand smoke, that is the person who is himself doing the smoking, and there is another concept, that is the second hand smoke, that is the person who is not doing the smoking but is in close vicinity with the person who is doing the smoking. So these persons are also at higher risk of getting cancer because they are getting exposed to the carcinogens which the smoking releases. So smoking in another form, that is the air pollution. Air pollution is another cause of getting the high risk of getting the lung cancers because the air pollution is also having high contents of these carcinogens, heavy pollutants, metals. And another is the chula practice that we have in Indian homes, that is the use of coal or wood for making the food. That also produces a lot of pollutants which are causing the high risk of getting the lung cancer. So this is the preventable things. There are certain factors which are non-modifiable, that is the age. With the increase in age, there are more chances of getting the lung cancer. Other is the heritable risk factors. There are some gene mutations which lead to the cause of lung cancers. Another is the family history. If you have a family history of lung cancer, there is a 1.7 to 2 times higher risk of getting a lung cancer. The take-home message with this video is that the smoking is the most and the major cause of getting a lung cancer. So tobacco quitting should be promoted to prevent yourself from this deadly disease of lung cancer. Thank you.
Hello, my name is Dr. Sahili Saha. I'm a radiation oncologist. Today I'm going to talk about the role of radiotherapy in lung cancer in honor of Lung Cancer Awareness Month. So radiotherapy is treatment of cancer with high energy X-ray. Radiotherapy uses high energy radiation beams to target and destroy cancer cells. Now it is very important in treatment of lung cancer because it has got a role both in curative and palliative setting. In curative setting, it allows the treatment to kill the cancer cells, and in palliative setting, when the disease is incurable, it allows an option to control tumor, to have reasonably good quality of life, to control breathing troubles by targeting the growing masses, also sometimes pain and bleeding. Now let's dive into the type of radiation. The most common type is external beam radiotherapy, which directs radiation from outside the person's body into the tumor precisely. There are a number of ways these things are fine-tuned. 3D CRT or 3-dimensional conformal radiotherapy is targeting the tumor precisely while trying to avoid normal tissue. So here what we do is we contour the tumor, or we draw the tumor on a CT scan and shape the beams so that only the tumor is targeted and normal structures are not irradiated. IMRT takes this a bit further, one step ahead. So what IMRT does is it allows us to control the intensity of radiation in each radiation beam. So this is very important when the tumor is close to normal structure or if it is complex shaped. So we can give higher dose to the tumor while giving less dose to important structures. Coming to SBRT or stereotactic body radiotherapy, it is a very precise, highly focused radiation, and used in in early tumors or small well-defined tumors. So it is generally given in a session in a number of 3 to 5 sessions and with pinpoint accuracy. This is especially important in patients with who are not candidates for surgery, because it allows us to treat the cancer, and it's often seen then that the accuracy is quite similar and at par with that of surgery. Radiotherapy planning uses advanced imaging and a lot of background work. So before we start treatment, we map the tumor so that we do not only consider the shape and size of the disease, but also how it moves with breathing. Every person is different, their breathing cycles are different, their breathing pattern is different. So we need to consider the motion into account as well, and so that we can accurately target the tumor while avoiding irradiating normal tissue, which is the primary goal of any kind of radiation treatment. Radiation is often given in conjunct or in addition with chemotherapy, but it is not given in case of SBRT along with chemotherapy. It can be given in some clinical trial setting, but it is not the rule. So to summarize, radiation is a very important tool in treatment of lung cancer. So in this month, as we raise awareness, it is important that you understand the importance of early detection and the role of radiotherapy that give the lung cancer patients a fighting chance. Thank you.